does one study having the overall survival and the other one does not sway your decision on which option you're going to go to?
I do think you have to think about those considerations. There were a good population of patients, I think it was almost 30% in the control arm, that were able to get SG later, get a future ADC. So, there was some exposure, although not clearly as much. I think when talking to patients, you have the data you have. If the goal is to live as long as possible, feeling as good as you can feel, you're going to talk about what does that look like for you and what do those numbers look like on average. So, I think our regulatory authorities think it's important since there is an FDA approval for Dato in the first line now. So obviously that's something to consider when you're thinking about how easy is it going to be to get this for my patient. But I think it's all a part of how we have to put this in context in our brains.
So for you, Reva, the whole idea of community health media is for the community.
Yeah.
We've been telling our community doctor, we've been educating them that overall survival is king.
Yeah.
All right. The same question as Alison, that's why I want to go back to you. What do you think about that? What do you think about one study showing overall survival versus the other one does not? Does it sway your decision in which option you're going to go for?
I think we're seeing this over and over on trials where, not every trial has crossover built in, but many of our newer agents, they're available already, or there's so many ongoing clinical trials with agents of the same class that many of our patients are going on to get the same class as the tested agent in the subsequent line of treatment. And a lot of times we're seeing no impact on overall survival as a result of that. And so I think more and more as a field, we're looking at that PFS2 as a very meaningful endpoint and as a surrogate for what the impact on long-term survival might be. And so I think maybe it's time to shift a little bit in the right setting. So for a study like this, where there was such significant crossover, I mean, over 80% of patients go on to get SG as the next line of treatment. I really think you have to frame that and think about PFS2 as a very meaningful endpoint. That being said, I agree with you. I think survival is survival. It's very meaningful data, and it's very helpful to know that giving Dato-DXd up front has a survival benefit.